Today, the National Medical Association is launching an initiative to reintroduce everyone to an old nemesis that has haunted the health and circumstances of African Americans for many years. That nemesis is a condition known as congestive heart failure. It's something to which everyone in our country needs to be sensitized, but especially so if you're African American. That message has now become deeply ingrained in the mindset of the National Medical Association, and we are today launching an initiative to increase the awareness of everyone about this condition, but especially in African Americans who suffer an unheard of toll due to this disease. It's time for us to change our behavior and do something very different about this disease.
What are the warning signs and how serious a disease is this?
Regardless of someone's race, ethnicity, age, or gender, heart failure is a disease process that is typified, or that is to say, it occurs when the heart is not able to keep up with the needs of the body. Typically, someone might have shortness of breath, swelling, excessive fatigue, in a scenario or a setting where there's known heart disease. When that occurs, that's heart failure, and action needs to follow.
And what is the initiative going to involve in terms of being able to get the message out?
The initiative that we're launching today with the National Medical Association has three platforms. The first is awareness. Many people have forgotten about this disease and how important it is. And we need to be aware that it is there and it uniquely affects African Americans. The second is a call to action, to recognize that it's not a futile illness. There are things that we can do, some things that we can do, especially in African Americans. And the third message, which is the most important one, is that if you have this disease or if your heart muscle is not strong, we should do all the right things at the right time for the right patient under the right circumstances. That's quality of care. That's what will make a difference regardless of race, but especially in this scenario where African Americans have such a burden of this disease.
How widespread is the disease?
Across this country, 1 in 5 adults over the age of 40 will eventually develop heart failure. In the African American group, the incidence that is a likelihood of getting this disease is twice as high as in everyone else. This is a serious illness with major consequences. It's not rare. It won't go away. We need to take action.
Heart failure is actually a devastating problem in the African American community with very high rates of hospitalization, and we have treatments now, and patients and physicians should be aware of, but there are also some information we need to continue to sort through in terms of the risks and how to avoid those risks.
Can you give us some example maybe from personal experience with patients so people might know just how serious this problem is?
So for example, I had a patient recently that has had problems with shortness of breath, and she was being treated for asthma, but she does have a history of high blood pressure. So when patients with risk factors such as high blood pressure or high cholesterol presenting with shortness of breath, it's important for the physicians to do an evaluation, which almost always involves an ultrasound scan of the heart to look at the heart function and check and see if indeed the heart is functioning appropriately.
We must recognize that there are true disparities in heart failure. The NMA Heart Failure Consensus Panel now suggests we look at disparities in the risk factors, disparities in socioeconomic status, disparities in the social determinants of health, which is how people live and where people live, how they are affected by these in terms of outcomes. Finally, I think evidence-based medicine such as the fixed dose of isosorbide nitrate and hydralazine added to conventional medications, including ACE, ARBs, and beta blockers, in self-identified blacks with symptomatic heart failure, saves lives, decreases hospitalization, and improves quality of life.
How serious is the role of hypertension?
Hypertension underlies most of the heart failure we see in this population. We still should look for coronary disease, which is also disparate, but heart failure related to hypertension is the #1 cause, especially in the younger age groups of patients who are self-identified black with heart failure.
Are you encouraged by what you've heard here today?
This was a great panel. I'm pleased to be a component of the NMA Consensus panel, and I think in the future, taking these sorts of data and getting to policymakers will make a big difference.
Heart failure is preventable in terms of how they control risk factors such as high blood pressure. That is really the big thing. If we can get high blood pressure better treated, we would have less congestive heart failure. But once that heart failure sets in, it's important to use the right treatment, and there are now some specific treatments that are available for African American patients.
I think if we remember nothing else but the importance to focus on heart failure, to screen for it, to be aware of it, to think about the symptoms, to just recognize the vernacular, heart failure, and let that be a big first step towards doing something positive.